right, welcome everyone to the September 11th, 2023 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwiazdowski-Govin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Jennifer Maynard, I don't see on yet. Dan Finn.
Dan Finn here.
Austin Magnet.
Austin Magnet's here.
And Bill Muller. I saw just snuck on in before.
Oh, Muller here.
Back from vacay.
Yeah.
Staff and anticipated speakers on the agenda. When I call your name, please respond in the affirmative. Nancy Connors.
Nancy Connors here.
Amelia Houghton.
Here.
Karina Scott, who I know is dealing with power issues.
Here.
Ian Wong.
Here.
Devin Thornton.
Here.
I apologize in advance, Gina Dury
Oh,
Pergola Tadeo. As someone who has a horrible last name, I always apologize in advance.
here.
Emma Stefanski.
Can't hear you.
Looks like she might have froze. Oh,
I'm here.
okay. Phil Legere.
Here.
And that is it for what I was expecting. We have a full house tonight, which is always nice because often we don't have too many people. I'd like to open the meeting. Can I get a motion from one of the board members to open the meeting?
This is Dan Finn. I'd like to make a motion to open this meeting.
Is there a second?
This is Austin Magnet. I'll second that motion to open the meeting.
All right, and then roll call vote, board members.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
Karen Gwiazdowski-Govin, aye. All right, good evening once again, everyone. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the act extending certain COVID-19 measures adopted during the state of emergency in Massachusetts. This act includes an extension now until March 31st of 2025 of the remote meeting provisions of former Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meeting. For this meeting, the Grafton Board of Health and other attendees are convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note the meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that you take care not to screen share your computer because anything that you broadcast will be captured by the recording. Any supporting materials that have been provided to the members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. And then just before we turn to the first item on the agenda, just allow me to cover a few basic ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. For any topics, I'll introduce speakers on the agenda for said topic. After the speakers conclude their remarks, I'll invite the board members to provide any comments, questions, or any motions. As always, please identify yourself by name when speaking. Further, remember to mute your phone or computer when you're not speaking to avoid background noise. And then please remember to speak clearly in a way that can help generate accurate meeting minutes. For any responses, please wait until the chair, yield the floor to you and state your name before speaking. And then finally, any votes on any motions made during this meeting will be conducted by roll call vote. All right, so with that, first is, since it is September 11th, we wanted to do just a moment of silence for those for the fallen from September 11th of 2001. So if you'll join us on that for just a moment. All right, well, thank you, everyone, for that. And so now we will turn to the first topic on the agenda, which is the Alliance update, including some welcoming of some new faces to the group. So I don't know who from the Alliance wants to kick this off first. Who wants to go? All right, Karina.
Hi, so we do have some new faces slash names in case you have to turn off your camera for a reason. So I'll let the new health inspector, Emma and Devon, present themselves. And then we also have Gina, and I'll talk about why Gina is here in a moment. So Devon or Emma, if you guys want to introduce yourselves.
Hello, everyone. I'm Devon Thornton. I'm new to the Public Health Alliance. I'm the environmental health inspector for Grafton and West Boylston. And it's wonderful to meet you all today.
We're very happy to have you on board and look forward to, on behalf of everyone, including Nancy also, who you'll get to know very well in the office. We're happy to have you on board, and obviously any questions come up, feel free to reach out.
Thank you.
Hi, Emma. I'm with Alliance, and I am currently in Shrewsbury, but I'm sure I'll be stopping by Grafton as well.
Happy to have you on board also with the Alliance, and I'm sure at some point in time, whether it's coverage with vacations or otherwise, that you'll definitely get to know some about the town of Grafton.
Both Emma and Devon come from our inspectional services here in Worcester, so they're
Okay.
well-rounded inspectors, and I think they'll be hitting the ground running smoothly, I think. So today was their first day, so let's not scare them off. And then we have Gina here, who is my intern here for the Alliance. She is a master's public health student, and hopefully she can help you guys with the opioid settlement. Forming that committee, she can help you guys with the capacity and just help you guys with, sending invitations, getting, stakeholders, community members involved in the committee and so forth. So she's here to help you on that project.
Welcome, Gina.
And the only update I have is so far since last time we met, we had 25 inspections done at Grafton, a combination of food and some nuisance, but nothing out of the normalcy for you guys. So everything is good. I think that really concludes my update.
We like normal, nothing out of the ordinary, mundane inspections.
Karen,
Yep, Nancy.
do you want me to continue to do the reports like I did when Julie was here and Micah? Or do you want the Alliance to take over?
I mean, if possible, the Alliance to do it, but I'd say let the new inspectors kind of get past their first day, and get their feet under them and stuff. So I'd say let's revisit that once things have settled a little bit.
What happened with the
There's a
donuts?
lot of septic in there. Oh, sorry, a lot of septic in there from Phil. Wells, septic plan reviews, issues with COCs, L5 reviews, soil testing. He's been very busy.
For being retired, he's been very busy.
I keep him hopping in Grafton.
Austin, I think you had a question.
Yeah, I saw there was a Donut Star inspection a couple weeks ago, and they were shut down on the 29th. Was that resolved? Are they back open?
Nancy, you probably have the latest on that compared to even.
They were not shut down. They were given 5 days, 10 days, and I think 30 days to do the corrective actions. And on the first inspection after the 5 days, they had made a vast improvement.
Oh, wow.
Yeah, so it takes time to order some of the things that they need, which is why they gave them the 30 days.
Yeah, exactly. Okay.
Okay?
Thank you.
Thank you. Yeah, awesome. I actually had that as old business, so thank you. One topic.
Nancy,
on-
that was correct. That was the update I have on the log, that they weren't shut down. They were giving 30 days, and it seems that they're complying.
Which is ultimately, no one wants to shut anyone down if we don't have to.
Exactly. Yeah.
So yeah, so I was happy to hear that same thing, that at least we didn't have to shut them down and they're going in process the right way. Right, and then I think Ian, before we get past anything with too far along with the lines, if you want to just give us a brief intro. And thank you for joining this evening, by the way.
Yeah, thanks, Karen. So I'm Ian Wong, the new Deputy Director of Division of Public Health. I've been here now, I think it's my third week, something like that. But I'm coming from Tufts University, where I was there for 16 years as the director of the Department of Health Promotion Prevention. Prior to that, I was at the Department of Public Health, where I actually ran under Governor Romney the first opioid prevention efforts for the Commonwealth. So I wrote the first opioid prevention RFRs, did that kind of piece. And I was an elected Board of Health member for the town of Natick for 9 years. And I was the chair during the COVID piece. So got to do that, and also help put together their opioid prevention efforts. So, that's a quick overview, and, it feels like old times being back on a board meeting. So know what those are like. So I appreciate it.
Well, happy to have you on board. Unfortunately, as you are fully aware, COVID is not gone yet. But we all lived and breathed through it in terms of board membership. So yeah, we feel your pain. And so I think that leaves Amelia.
Hi, everyone. This is Amelia. Just give you a quick nursing update. So our regional public health nurse, Molly, does the blood pressure clinics in Grafton. And she went to the senior center in August. And she actually screened 19 participants. And the Housing Authority on Forest Lane, she was able to screen 2 participants in one session. And also the office on Maxwell Drive, 1 person showed up for that. So we're still monitoring those last 2 locations to see if we need to make some changes, or maybe the winter will bring more out. So more to come on those. Let's see. Yes, we've had one, I would say, real cluster in one of the manors. There are about 32 COVID positive cases there, but that went from July into August. It spilled into August. Technically, you may want to say that was a July case, but it concluded in August. So just bringing that up. And the state was involved in it. There weren't any issues. And then we have planned with the Worcester Seniors, the Grafton Senior Center, a health fair on the 22nd, which is a Friday, and it's 9 to 3. So I'll be reaching out to Shannon and the rest of the office this week to see how we can help them set it up and what they need from us. We can set up blood pressure screenings, handouts, outreach, whatever's needed. So we'll be following up with that. And that's the quick version. I also now have permission to order flu vaccine for kids. So I will be reaching out to the school nurses to set those up. And I think that's it for me.
Amelia, what about the email you had sent out um,
Um,
doing,
I don't know enough. But I will send you an email when I have details. That way we can send it out to everybody on this call. I don't want to say anything now if it doesn't come through. We're trying to work with the pharmacy to get employees vaccinated there. And also, I'm trying to get them to also come to the senior center to do adults. So it's early stages, just working on it this week, actually. So
Thank you.
more to come on that.
Dan?
Hi, Amelia. This is Dan. By one of the manors, is that a Worcester Housing Authority place or is it a rest home? What was the manors piece?
It's Crescent Manor on Grafton Street. It's actually in Worcester,
It is, okay.
yeah.
Because there's a Crescent Manor in Grafton too, right?
Yeah.
So that might be Grafton.
Yeah, actually, yeah, it was written down as Grafton.
Yeah,
Um,
that would be,
yeah, I think it would be the Grafton one.
okay. That's good to know. And then also, last year, Bouvier Pharmacy out of Northborough, I think, worked with the schools in Grafton to provide vaccines for elementary kids. Do you know if they've been in contact with the town or with James Cummings? I think they made an arrangement with him last year. Do you know anything about that?
I don't know about them, but I'm trying to work with one of the Osco drugs who is very willing to come to our towns to do what they're doing in Shrewsbury. So
Yeah.
that's why I'm trying to get them involved, and they don't charge a fee. Whereas some of the other pharmacies like Walgreens now charges a fee.
Right.
So we don't need that because they're taking the administrative fee. You know, it's kind of like they're getting paid double. So if they're kind enough not to charge and they're willing to come out, I think it benefits everybody.
Yeah, and I think, you know, if a person has insurance, they take that insurance information and try to bill it.
Yeah,
But if they,
the more insurance, the better, yes.
right,
The
okay,
more fee they collect and the better it is for them, but also equally good for us.
but if that contact doesn't work out, you may want to check with Bouvier Pharmacy. I could get you that information.
Okay,
I think the owner lives in Grafton, actually.
oh, even better.
I think so. All right, anything else for the Alliance? Amelia, I don't know if you want to touch on COVID. It's our next topic anyways, if you have any updates.
I just know that they have approved the next booster. So we're just waiting on for that to be rolled out. And I know there's at least 1 or 2 new strains, but it doesn't seem to, I mean, cases are going up, hospitalizations are going up, but I don't think people are getting sicker. I see a lot of people who have very few symptoms, if any, and of course they're still infectious if they're still positive, because you don't know what your viral load is, other than, you know, you can guess if your antigen test comes up red immediately, you know, you're loaded, and if it takes a long time, you're at the back end, but you still have a load, you know. So we're just basically have leftover tests and masks, and they're really, at this point at least, unless something changes, I don't know that there will be more funding to provide like emergency use testing and masks. So people may have to purchase their own. The city is still finalizing their employee COVID policy as well. So that should be coming out soon. And with that, if they approve it the way it's written, people are responsible for their own masks. So until we find more money, I guess. So.
Thank you. Yeah, I'd heard, I didn't see much news or anything, but I did see it fly by that FDA had done their blessing on the latest and greatest, and I think CDC meets tomorrow sometime tomorrow, for a similar discussion in terms of like how we've seen it in the past. Like, is it going to be everyone can get it? Is it going to be, 65 plus and immunocompromised at first, and then afterwards it becomes the rest of the population? Yes, more to come once the CDC does their chat tomorrow.
It sounded like what you just said, like older population and immune compromised at this time. So it's quite interesting.
Yeah, which wouldn't be surprising based on prior history.
Yeah.
But more to come. Oh, Dan.
Yep, just one more quick thing. This is Dan, and Nancy, correct me if I'm wrong, but I was in the office the other day, and in terms of your stockpile, apparently there are no more test kits, no more hand sanitizers, but I think you do have some masks, correct?
That's correct. And
Okay.
Amelia, if you could give me a phone number, I need to check for some residents if their test kits have expired. They don't know, and I wouldn't know.
We were being told was the expiration date on the kit, you can go 1 year out, as long as the liquid is still intact. If it's dried out,
Okay.
obviously you can't use it, but people are using them 1 year out.
Great,
Nancy.
thank you.
I actually created something with the help of our vaccine education team here in Worcester that I'm going to be sending you probably by tomorrow. It's something you can post on the city website, or if anyone comes by the office, it's QR codes identifying different test kits that they can kind of click on, and they can see what is the extension on their test kits, so they don't have to throw them away or do any guessing. So it's on the most common test kits here in Massachusetts that the flyer with the infographic explains. So if someone calls you, you can also help them over the phone too, because I know there's some residents that are calling as well. So I did develop that with our team's help, so I'll be sending that to you shortly.
Good, thank you.
I can fully attest to the fact I've got a mishmash of test kits left over, whatever varieties were available, and sitting there and knowing how to use the web and all of that, just in knowing, having developed medical devices in the past, knowing how lock codes and all of that works and how cryptic they can sometimes be, sitting there and trying to go onto the FDA's website and like find the one random lock code that I happen to be looking for, and then going, oh, no, it never got extended, or oh, look, it got extended, or it got extended, but it's still too late. Because some of the ones I have are, I've tried to FIFO over time, first in, first out for expiration dates. Not that I have that many at this point, but still, it's like, oh, never mind. But yeah, it can be not necessarily tricky, but it can be confusing because the lock codes all start to look like each other. It's 1 0 or an 8 or something that's different, and you could easily find the wrong one. All right, so then just to tag on to the COVID side of the world, the usual, but even more so now where we are starting to see, more hospitalizations and more cases, et cetera. Just the reminder to citizens in town and employees in town, et cetera, that may not be citizens here that are watching this or read the minutes afterwards, to take appropriate precautions. As always, yes, if you're vaccinated, but as we all know by now, that doesn't mean it's going to technically prevent transmission. It's, or stop you from getting sick at all. It's more of the take the appropriate precautions, especially if you are immunocompromised or elderly, or you live with immunocompromised elderly, or you have family members, whatever the case is that you come in contact with, just keeping that top of mind, because not only is COVID rising up, but pretty soon we'll be at flu season. They're talking RSV again as a concern. So, they're talking the potential triple-demic again. So better safe than sorry, and getting sick yourself or getting someone that you are close with sick.
So also Karen, I can provide Nancy with the homebound vaccination number because they provide COVID vaccine, not anything else. At least they haven't up to this point. So if that's something you guys want to post, because we get a lot of calls from homebound people.
Yeah.
Not
It wouldn't
knowing.
hurt to post it, definitely, because especially where there's going to be the next one coming out. You can't guarantee that everyone in town obviously can get out or have a ride or anything to bring them to a CVS or a clinic or anything like that. So better to post it than not post it, I'd say. It's another resource for everyone.
I'll share with the senior center too.
All right, so if there's nothing else on COVID, then we will jump to the next topic, opioid settlement funds. We've been talking about this for a little while in terms of trying to put together a subcommittee. What can the funds be used for? What are the needs within town, et cetera. So Nancy's been helping kind of herd the cats in terms of trying to figure out like what's needed, who might be potential, attendees. I know, Bill, you had volunteered to help out with this. So Nancy, I don't know if you want to kind of give, you're closest to this than even I am, in terms of like what's transpired, who you've reached out to. I know like Mary in finance, that type of thing.
So from the Board of Health, we've got Dr. Muller, Dan Finn, I have a question mark. Jay Cummings from school. Yes, Dan.
Oops, there we are. Yes, I can volunteer to be on that committee. Frankly, I don't have time to be in a leadership position, putting an agenda together and meeting dates, but I'll throw my hat in the ring with Bill to be on the committee. And I don't know who approved, if the Board of Health approves this subcommittee, or if it has to go to the select board. I don't know anything about that. But I'm in.
Mary from the finance, our finance director.
Yep.
She has stepped up. I sent out the emails. I don't know if you read them or not. And who's the other one on there? Karina, you're on there, I think. And I believe there's a few people from Worcester who are taking the webinar. A few webinars coming up.
Right.
So right now I have 6 people, and now you wanted 7. I don't know, do you want me to reach out to the select board, or do you want someone from the, just a resident?
For the
That's where it
schools,
stops.
maybe the schools.
Is
We
Dr.
got
Cummings,
Jay.
or you've got Jay from the school.
Jay
Okay,
Cummings, yeah.
I'm willing to help with the board with that. And if I get something, one thing we did at Natick was we made someone from the select board was on it because, right, the chief of police, fire, all those first responders coming in there, and if, someone from the school board. And usually we ask the chairs, the current chairs of the select committee, because then we ask them and they could choose someone in the chair of the school board, if they want to be on it, or, designate somebody. But we figured those were the key players sometimes in town that if we had to make something happen, they had the oversight along with someone from the Board of Health. And then, we had also the legal team on it. And we also had someone from the Chamber of Commerce because they were impacted by COVID. But yeah, I'm willing to, give any support, any background you need.
So how many people would you like on the committee?
Well, I
Probably,
think,
probably best to have an odd number, just if there's things that get voted on. We all know odd numbers work out better than even numbers.
and it's up to, what you guys decide, but I think the recommendation, that we kind of feel like when we do some of this work is that we invite stakeholders of the community that have been impacted, like spiritual leaders, maybe community leaders that have been impacted, or any community members. I know Gina has been drafting a invitation letter that we can send it to you guys, and you guys can edit it, see if you guys want to use it as to send it to community members that you guys want to nominate or kind of target, letting them know, why this work is important, what the committee is going to do. You guys can start convening, and as invitations go out, people can join the committee. And then Mary has been gracious. I also met with Mary, and Mary was graciously to make sure that she's aware what the deliverables are of the grant, what can the money be spent on, what it can't be. So she's there to kind of guide you there. If there's an idea that sounds great, but maybe it's not something feasible per the grant restrictions. So
Yeah.
she's there for that part as well.
Right.
I believe Jen from Worcester, and also myself and Gina will be in the committee as well. And Gina can take notes for you guys, and she can also help you guys establish the agendas, etc.
And the other group you might want to invite to is the recovery community, and a lot of times the family support communities, because they're always those who had loved ones or in relationships with someone, with opioids, because they're a driving force in the communities.
We've got a lot of people we can have on the committee. I don't know which way you want to turn. But I know you would go on select board, fire, police, board of health, legal team. We don't have a chamber of commerce. That's 1, 2, 3, 4, 5. That's
Yeah, we got Jay from
5.
school, unless
Yeah.
Jay wanted it to be a school committee member instead. But I mean, if
Well,
Jay's
he said he
willing,
would do it.
okay,
He would do it, and if he can't, he's going to have someone step in for him,
okay,
someone from the school committee.
yeah, because school is obviously critical.
Yep.
Yeah, Mary, which, yeah, that was one of, I think, our biggest things with Mary with finances, like, what can we do? How do we do some of this? Like, how does the funding even get to where it needs to be? All that stuff that none of us ever have to worry about. That just kind of happens.
I think my question for you guys would be, next steps to move it forward is to understand the frequency of how many times you want to meet, what the mode will be. Will it be remote? Will it be hybrid? And how long this committee is going to last. I know that you guys have a bit of funding now, but you will get the rest available in the summer of 2024. So it looks like you could go until next year, until the end of next year or so. But that's all important to know for these letters. If you want to invite information or invite community members or let them know what's happening, that's an information that maybe we can establish today.
So who appoints this board, Karina? I'm sorry, the subcommittee.
I'm sorry, can you repeat that?
Who appoints the subcommittee, the opioid subcommittee? The Board of Health?
Yep, yeah, that would be correct. Correct, Ian? I don't know if you. feel
Yeah,
about
because
that.
this would be under the Board of Health. And so you can create the committee. Karen would, I don't know if you have to vote, but I guess you could vote on, you know, if you're going to create this committee and then, you know, formulate how you can pull people together. But, you know, Karen would kind of say, yeah, we're creating this subcommittee under the Board of Health to address the opioid settlement funds.
Yeah, at least it gets the ball rolling.
And then you have an official committee.
Does it have to be Karen or can it be Dr. Muller or Dan because they are actually on the Board of Health?
Well, I was saying that the proposal could come from Karen, just as the chair, and saying that, you know, she wants to
Okay.
establish this committee and then you place who's ever on the committee.
Yeah,
Okay,
so I-
good. Thank you.
See, I would see it like as in kind of, we would do our typical like want to do it, then like a motion, a second, roll call vote from the board members, and then it becomes official that there will be a subcommittee. And then from there, we need to like, you know, get a subcommittee finalized. We know we have pieces and parts of it that are interested already, but then said subcommittee would also need to then figure out their frequency of meetings, et cetera, which I don't want to drive obviously outside of that, because if I can't partake in it due to time constraints and everything, I wouldn't want to be the one that's sitting there going, you have to meet every 2 weeks or whatever the case is. So, all right, well,
Right, so once the subcommittee is formed, they can decide how often and if it's remote or in person or both, set the agendas, things like that, right? Yes, no?
Yeah, and Karen, maybe one of the things, you know, if you put this forward, you can just appoint one of the one of the board members to be the chair just for right now. You know, and then they can help, you know, just make sure everything's moving forward, and we can help, you know, the Alliance pull this forward. But at least you have someone who's going to be in charge right now, and we can give the support that's needed.
all right, Dan or Bill, who's gonna rock, paper, scissors? Bill? That's what I thought, but I didn't want to like just sit there and like throw it out there and have you be like, no.
I'm
like,
the retiree, you know.
on the side be trying to tell me with like code, like, no.
No. I think it's important. It's an important enterprise.
No, agreed.
Thank you, Bill.
Yes, we definitely appreciate it. All right, so, Dan,
That being said, I'd like to make a motion that the Board of Health form a subcommittee for the opioid settlement funds. We'll start there.
That's good. I'll second that, the start of that subcommittee.
all right, roll
Dan.
call votes.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Karen Gwiazdowski, Govan, aye. We have progress. Dan,
I'd like to make another motion that we elect Bill Muller, Dr. Bill Muller, as the chair, or at least temporary chair.
Appoint.
Appoint.
point.
Okay, there you go.
No election.
No election.
We don't want to see that vote. So anyway, appoint Dr. Bill Muller as the chair of the opioid settlement fund committee.
This is Austin Magnan. I will second the appointment of Dr. William Muller to the chair of the subcommittee.
All right, roll call vote, everyone from the board.
Dan Finn, aye.
Austin Magnan, aye.
Do I get to vote?
It's a little
Yeah.
awkward to vote for yourself.
Probably.
Feel free to abstain. Karen Gwiazdowski, Govan, aye.
Then I'll gracefully accept.
Well, we greatly appreciate it. And thank you for stepping up and helping out with this, because it is a very critical piece of work. And, you know, no one wants to let funding for something so critical go
Right.
by the wayside and not utilize it the best ways possible within the community. So,
Yeah, I do think, as we have talked about before, I think one of the initial things we have to do is understand what other initiatives are already in place. And you know, endeavor not to duplicate things that are already going on, or perhaps to be able to reinforce or augment things that are already being done.
Yep, Dan.
And yep, this is Dan again. And so anyway, tomorrow there is a webinar type of thing that I'm going to register for in the morning and hope to hop on at least for this particular piece of it. Probably for
Yeah,
the,
I will as well. Yeah.
it's around 3 o'clock, I guess. Good.
All right. Well, we greatly appreciate it, and we're all here to help and support, and looking forward to getting this moving forward, and totally agree in terms of like, we don't want to overstep and duplicate. And, you know, we might find out that, hey, there's something that exists, but they don't have the funding, but it's something we could use this funding on, and then we can augment it, like you said, Bill. Where
Yeah.
maybe they have limited resources and can only do so much, but this funding would allow for more to happen for the services that already exist.
Right.
All right, well, thank you everyone for a good discussion on that. And now we have some progress moving along. And thank you, Nancy, also for, like I said, helping to herd some of the cats here to get further information in contact with Mary and Jennifer, et cetera, so. All right, so next up, Phil's favorite topic, state well regulations. Not to be confused with state septic regulations. Phil's other favorite topic. So this was, we had Phil join us for board members' sake, but also then for anyone else from the Alliance sake, because the state had put out some model regulation updates for the well side of the world. So we figured we might as well get the expert, Phil, to help us with, take it, Phil.
Well,
Take the compliment.
basically, as you stated, they're model regs, because the state has no jurisdiction over private wells. Their jurisdiction is public wells. One of the additions, I believe, is some PFAS testing requirements, because that's entering our world. Eventually, it'll hit most probably urban areas and suburban areas, not that rural areas are exempt. Town of Westminster, which I was helping out, has a designated PFAS area that they're dealing with. There are treatment systems that can treat PFAS prior to it becoming drinking water in your house. Any treatment system isn't free. I think they're around $3,000, but don't quote me on that. So one of the questions would be whether or not you would want to adopt that as a requirement. The downside of that is not everybody can do the PFAS testing. It has to be sent out like your VOC testing. That's really the question, whether you want to consider that. I definitely think it's worth looking at for discussion item moving forward, whether you wanted to add that to your regulations. So that's my opening statement, I guess.
Austin, I saw you jumped off mute.
So yeah, is this treatment system for the municipality to treat the drinking water, or are these for homeowners?
Well, again, there's two different worlds. There's the public world, which DEP regulates. And if you're a public water supply, you would deal with DEP regulations. This would be for any private drinking well, which Grafton certainly has those, because you don't have public water everywhere. And in fact, if I remember right, you have 3 different water districts. Is that correct?
2,
I think just two.
There's 2?
Yeah.
Okay.
but still,
You know, sometimes there'll be areas that might show up with PFAS hits, and you could extend public water supplies to them. That is one solution, although extending water supplies, infrastructure and very costly. But again, depends on, you know, how many are affected. The situation in Westminster was a composting facility
Hmm.
that was taking in a lot of paper fiber from paper mills. And as we're finding out, several companies, DuPont, 3M, created a material to make paper more grease resistant. And then that paper fiber got into the recycling efforts. And where this facility was relatively isolated at one time, now grew into housing development across the street,
Hmm.
along with a golf course, adjacent, down gradient, and drawing a lot of water where it wasn't before. In that case, the facility has a licensed site professional. Again, it's not fun's the wrong word, but it's not a good event for the businesses that was trying to do a good thing. But as those houses are built, treatment facilities are being put in, and then your PFAS levels are then dealt with. So something certainly to consider, but there will be an added cost. There will be added wait times, and then you know, added time to install treatment facility, et cetera, et cetera. Again, these are model regs. They put them out there in response to what they see going on across the state. But PFAS definitely aren't going away.
Mhm.
Those companies are in process of being sued, and I think some of the states are trying to get some funding from them to help pay for some of this. And then a public water supply, same thing, has to deal with it. So that's what I got.
I know looking through the model regs, it talked about even like if they were to put this in place as a municipality, and you were to do the whole model regs, no pieces and parts, let's say, of anything, then like if you were to sell your house, and kind of like how in the septic world you have to have Title V, and then deal with it if something goes south with the Title V during the sale. Similarly, if you were to adopt these model regs the way they are, you would have to require PFAS testing as part of that well testing. And then if I'm assuming, I don't remember, I don't have that page open right now, I can try to scroll to it, but if I remember correctly, you know, if PFAS was found, then at a certain level, then you'd have to deal with, as the seller, figuring out, you know, do you give money to a system to remediate or whatever the case is.
Yep. That's a consideration. We actually, in my little town of Royalston, we had DEP actually was had a program where homeowners wanted to have their well tested for PFAS. They were covering that for a time. I think they were trying to find out where across the state they were getting hits when we were doing our well regs. We left that out because we weren't seeing it at the moment. But with any reg, you certainly can include it down the road if conditions change. Unless, well, it's kind of like if you require it or you test for it, you most likely will find it someplace. And then once you find something, you can't kind of put it back in the box. So the question is, do you want to open the box? It's something I think you should consider. However, I think it's a process. You're gonna want to, within the board, become familiar with it. Then if you are considering it, you definitely probably want to have a public hearing, get some input. You also probably want to talk to your water people that deal with this, your water district folks, and use them as a resource to come up with something that makes sense and that it's fair.
Do we know if the Grafton water supply has been tested yet?
I think they're being required. All public water systems are.
Likely should.
However, I can't say that for sure, but that would be a starting point to see if they're getting hits. They have, I'm trying to bring back my memory banks here. They have some gravel wells, deep gravel wells. Trying to think the type of wells that they have. And you certainly had industry in Grafton. However, it's not, not just because you had industry, you may have incidents of it. So incidents in Westminster, again, were related to paper fiber and paper mills. So unfortunately, it's classified as a forever chemical, doesn't just disappear. So that makes some things difficult, especially when it's in what they were making was compost, which then was delivered to other sites. So like right now, there's a zone that's designated in Westminster. And if you have soil on that site, you're not allowed to move it off site. So if you're doing a septic system, sometimes you have extra material. You can't really, where you're gonna bring it. So there's some unfortunate pieces of this. But again, drinking water, I mean, we have, we've dealt with naturally occurring arsenic in Central Mass. You can treat for that. You can treat for PFAS. And, you test for volatile organic compounds, same thing. So I would recommend that you at least look into this. It's not something you're gonna just do spur of the moment. But it's something to consider.
Bill, I see your virtual hand up.
Yeah. Found a new button. I think it would seem that it would be, from just a logistics standpoint, that it make more sense to see what the public water supply compliance is with the PFAC. I don't think it would make sense to make private well regulations more rigorous than they are for public water supplies. Because I do think that would be kind of opening a Pandora's box. But I don't have a sense you know, these towns like Grafton that have public water, that have private suppliers of public water supplies. I mean, as you're alluding to, there's state regulation of that, and probably we need to first know what the status is of our public water supply in Grafton before beginning to kind of address what the private wells would be, I would think.
That makes sense.
Yeah, I think I agree. Like, it's not a snap decision, obviously. Something that I think we should look into, you know, try to figure out and find out from the public, the two districts we have in town, the Grafton Water District, which is Grafton and North Grafton, and then the South Grafton Water District, along with also looking just at like what the state's requiring from the public district side of the world on
Right.
top of it, not just what hits we may or may not be getting from our own public districts, but like what they're required to do in the first place as those districts, and then circle back after that to see, you know, what we found, et cetera. And then do we want to keep on marching down a path or not at this point in time? Because yeah, PFAS, I can tell you, definitely not from a water drinking perspective, is definitely not going away. I know enough about it to be dangerous from other avenues, but no, Dan.
Yeah, I agree. That's great, good information, Phil. Thank you. But I would suggest that, Nancy, not to throw a lot more stuff on your plate, but anyway, you got through COVID and looks like you got through most of your minutes. So maybe if you could contact the local water districts and maybe partner with Austin, who's our environmental guy, yeah, with any questions or interpretation, and we can touch base again next meeting.
Nancy, I can send you like a draft email with a few questions to kind of send over to them, and then maybe just copy all the board members on it.
Thanks, Austin. I appreciate that.
You're welcome.
Austin, you'll be the head of our water subcommittee.
The PFAS committee.
We don't need subcommittees for
The one man,
it's an odd number, so voting will be easy.
right?
All right, well, thank you very much, Phil. We appreciate it. It's great to see you again.
Okay,
So
you need me anymore?
I think we're good right now.
Okay, well, Nancy knows how to get a hold of me, so.
Thank you,
All right.
Phil.
See everybody.
Phil.
Nice. to
We're
see
always
everybody.
gonna need you.
Okay, bye.
Bye.
Right.
All right, proposed bylaw updates. There's been nothing new since the last meeting, so we have this as an ongoing topic, just on the off chance something new does crop up. So quick and easy agenda item. All right. Take a deep breath. Minutes, because it's a long list. All right, board members, as a reminder, for each set of minutes, motion, second, roll call vote. So everyone can take a deep breath because we've got 1, 2, 3, 4, 5, almost 10 of these. August 7th, 2023 minutes. Is there a motion? Dan, I see you off mute.
Yeah, I forgot to put it back on. So, yeah, this is Dan Finn. I'd like to make a motion to accept the minutes as presented for the August 7th, 2023 meeting.
This is Austin Magnan. I will second the motion to accept the meeting minutes from August 7th, 2023.
All right, roll call vote.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Karen Gwiazdowski Govan, aye.
Mhm.
All right, March 9th, 2020. This is one, these next two, actually, this one and the one after, ones that we tabled from the last one because neither Bill nor Jen Maynard were on the board at the time and we didn't have the quorum otherwise. So that's why these are back on here. So March 9th, 2020. Dan, I saw your hand up.
Yes, this is Dan Finn. I'd like to make a motion to accept the minutes as presented for the March 9th, 2020 Board of Health meeting.
This is Austin Magnan. I will second that to accept the minutes from March 9th, 2020.
All right, roll call vote.
Dan Finn, aye.
Austin Magnet, aye.
Karen Gwiazdowski Govin, aye.
And I abstain.
I
Okay,
beat you to it, sorry. All right, July 13th, 2020. Dan,
Dan Finn, I'd like to make a motion to accept the minutes of the July 13th, 2020 Board of Health minutes as presented.
This is Austin Magnet. I will second that motion to accept the minutes from July 13th, 2020.
roll call vote.
Dan Finn, aye.
Austin Magnet, aye.
Karen Gwiazdowski Govin, aye.
This is Bill Muller, I abstain.
All right, so next up, November 2nd of 2020. Dan,
This is Dan Finn. I'd like to make a motion to accept the minutes of the Board of Health meeting of November 2nd, 2020 as presented.
This is Austin Magnet. I will second that motion to accept the minutes from November 2nd, 2020.
roll call vote.
Dan Finn, aye.
Austin Magnet, aye.
Was I on the committee?
You were, you were.
Bill Muller, aye.
Karen Gwiazdowski Govin, aye. I wrote notes in my little, like, not a cheat sheet as it were, but like which one, who was on the board when, because I know we had the transfer certain dates. December 9th, 2020.
This is Dan Finn. I'd like to make a motion to accept the minutes of the Board of Health meeting of December 9th, 2020 as presented.
And this is Austin Magnet. I will second that motion to accept the meeting minutes from December 9th, 2020.
Karen Gwiazdowski, roll call vote, sorry.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
Karen Gwiazdowski Govin, aye. May 17th, 2021.
This is Dan Finn. I'd like to make a motion to accept the minutes of the Board of Health meeting of May 17th, 2021 as presented.
This is Austin Magnet. I will second that motion to accept the meeting minutes from May 17th, 2021.
Roll call vote.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
Karen Gwiazdowski Govin, aye. July 19th. Did I skip the June? Hold on.
Yep.
We reached
June.
June.
June
This is
7th.
Dan Finn. I'd like to make a motion to accept the minutes of the Board of Health meeting of June 7th, 2021 as presented.
And this is Austin Magnet. I will second the motion to accept the meeting minutes from June 7th, 2021.
Roll call vote.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
Karen Gwiazdowski Govin, aye. That's what I get for not typing my notes of who's doing what in fast enough. And I was off. July 19th, 2021.
July 19th, 2021. This is Dan Finn. I'd like to make a motion to accept the minutes of the Board of Health.
This is Austin Magnet. I will second the motion to accept the meeting minutes from July 19th, 2021.
All right, roll call vote.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
Karen Gwiazdowski Govin, aye. And then August 16th of 2021.
This is Dan Finn. I'd like to make a motion to accept the minutes for the Board of Health for August 16th, 2021 as presented.
This is Austin Magnet. I will second that motion to accept the meeting minutes from August 16th, 2021.
All right, roll call vote.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
Karen Gwiazdowski Govin, aye. Thank you, board members. All right, almost done with those. Mail and correspondence, didn't see anything come through. Old and new business, we already touched on Donut Star. So that the only other thing I had was just the ongoing reminder that is still tick and mosquito season. We have definitely not had a hard frost by any stretch of the imagination at this point for the mosquitoes. So everyone should continue to take precautions with the 5Ds and everything and be vigilant outside as daylight hours are shrinking, unfortunately. So just definitely continue because it'll be some time, I'm sure, before we're seeing any type of hard frost that would put us out of the risk from the mosquito side of the world, especially.
And there were a few of those West Nile cases. I think one was in Worcester.
Mhm.
One was in Canton.
Yeah, there's been a few. Knock on wood, it has not been as bad as of a season as I think it was the year before COVID hit. That we
Yeah.
had with all the EEE cases and everything too, but still, there's definitely some human cases with West Nile. to be concerned with. So it's both of the viruses are out there. It's just not been as bad of a year as that previous year that we all think of, with the EEE especially. Dan?
Yep, this is Dan again. I just wanted to mention sort of under new business to Nancy that I agree with her response to Claire, who's the Tufts veterinary student, who's asking us if we wanted to have a fall rabies clinic and a spring. And I think we should stick with the annual one in the spring, which is what her response was to those folks. And we have plenty of time to plan that. I don't know how everybody else feels. They may differ in opinion, but there's a lot of other stuff going on this fall, you know.
Yes. Agreed. Right, so other than that, upcoming meetings. All right, October 2nd, we have as remote only. November 6th, we currently have as hybrid. December 4th, we currently have as hybrid. Then January 8th, 2024, we have as remote only. February 5th as hybrid currently. March 4th as hybrid currently, and April 8th as remote only. So that is all we had on the agenda tonight. Dan?
One last thing. Our next meeting is in fact, I guess, before a town meeting. So if we need to come up with something on the proposed bylaw changes, we'll be able to do that at our next meeting if it's still on the agenda, you know.
Yeah, like I said, so far there hasn't been anything that was of concern or to contest, shall we say, that they proposed, but you know, there's still some time before it's final.
And lastly, I just would personally like to salute the first responders on 9/11. You know, it's just amazing. I can't believe it's 22 years. I happened to be on a plane that morning in Providence at 9:15.
Yeah.
And so it was pretty scary too. But anyway, sorry about that.
No, don't be sorry.
We actually interviewed a person for a job in Milford who had a ticket to one of those planes
Oh, wow.
that he hadn't made it to the flight.
Phew.
He decided to change vocations.
Yeah. It's a lucky person.
Mm-hmm. All right. Is there a motion to close the meeting, Dan? Nope.
This is Dan Finn. I'd like to make a motion to close this meeting.
This is Austin Magnet. I will second the motion.
All right, roll call vote, everyone.
Dan Finn, aye.
Austin Magnet, aye.
Bill Muller, aye.
Karen Wisdowski Govan, aye. All right, well, thank you, everyone,